Learn later this morning if more people should be allowed to get the COVID-19 vaccine starting next week.
That's what the state's top health providers are working to figure out. Adriana Mendez has more on who is being recommended to come up next. Adriana?
Well, today the state's top health officials are meeting to discuss what additional groups should be included to the 1B phase of vaccination rollouts. Now, police and firefighters in the 1B group have already started their vaccination process, but if the committee approves the recommendations made by the Vaccine Distribution Subcommittee yesterday, health officials say it would expand the 1B group to include 1.6 million people. The subcommittee says they received about 5,000 public comments on who to add to the group, and ultimately, they ended up recommending to add prisoners, all K-12 staff members, daycare workers, transit bus drivers, and 911 operators. They also are including those who work in the food chain industry, from food production plants to hunger relief aid, agricultural and grocery store workers. The subcommittee says they've received about 1,700 comments and letters from those in the food chain industry, with the majority of the letters making their case as to why they should be included.
Work in conditions where they're close to the public. The public doesn't always follow social distancing or masking expectations.
Now, some doctors did express deep concern about not adding people with pre-existing health conditions to the 1B group, but the argument was made that that population size is too large for the limited number of vaccines available. If this list is approved today, it will then go to the governor for final approval. In the newsroom, Adriana Mendez, TMJ4 News.
Thanks, Adriana.